Okay. I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here reporting today on COVID-19 in Simcoe Muskoka. Since I last reported on Friday, April the 24th, we've had some increase in cases. So presently, we've had an elevation of 24 new cases. When I last reported, we had 237. We've also had to remove 2 cases from our line list. One was assigned to another health unit. Another was actually initially tested to be presumptive positive, but further testing indicated that it was actually a negative test, so we removed that test. We've got one new case related to the outbreak at Bradford Valley. That's one of the residents, a woman in her 70s. We've had 2 new cases from a new institutional outbreak. Owen Hill Care Community in Barrie declared on April the 24th, Friday, after the media scrum that I held with you. So one of these 2 is a staff member and the other is a resident, a male in his 80s. We've had no additional deaths, so we have a total of 15 deaths. No new hospitalizations. Currently we have 8 people in hospital. Of those, 3 are in the intensive care unit. And we've had 13 cases that have recovered. So if you look at the 24 new cases, I've already spoken to 3 of them being associated with long-term care facilities. That leaves 21 that are sporadic cases in the community. Their ages range from less than 10 to their 60s. All are in self-isolation, so none of them have been admitted to hospital. None of them are travel related. So we have 8 that are close contacts of other cases and 9 that are community acquired, and 4 that are under investigation. So that always speaks to me of the importance of people being aware that this is transmitting in the community, that when people go out, you need to be very careful and maintain a 2-meter distance from other people. You need to be hand washing. You need to be carefully considering whether you need to go out at all. And if you develop any symptoms, you need to put yourself into isolation and seek medical attention and assessment, calling up one of the assessment centers. I am encouraging people to be tested. There are priority groups for testing in the province, but there's also a high capacity in the laboratory system now for testing, and so I encourage people to get tested even if you don't fall into those priority groups, or at least call the assessment center near you and inquire about the potential to get tested. If I draw your attention to the long-term care facility outbreaks and look at Bradford Valley, they now have a total of 40 laboratory confirmed cases. This is up from 39 when I last reported, so we had the additional resident case. So we have a total of 34 residents as cases and 10 staff, 6 of whom live in Simcoe Muskoka and are on our line listing. 5 of our staff cases have recovered. 4 of the cases are from out of jurisdiction, not in our area, not on our line list. One of the resident cases is hospitalized, remains hospitalized, and there have been 7 deaths among the residents to date, so there have been no new deaths since I last reported. And we have some that are quite ill, and so certainly we look to their care. We're aware of the support that they're getting at that facility and aware of just how serious this virus is in the senior population. So we've tested all of the residents there, and we've had 236 tests come back negative. Among the staff, we've tested 153 that were all negative, and as I've indicated, we've had a total of 10 staff who've been found to be cases. If we go to the Barrie area, IOOF has a staff member that's a positive case. They've had no other staff or residents test positive. So to date, we've had 75 negative test results among the residents. We collected 120 tests on April the 23rd from the facility for testing of all, and another 120 were collected on April the 24th. So we are awaiting some results to come back. For Woods Park long-term care facility, we have 2 staff who are positive cases, which is unchanged from when I last reported, and none of the residents have been found to be positive to date. We've had 32 negative test results come back on the residents and 34 negative test results come back on the staff, and we're awaiting further test results. We have the new outbreak, Owen Hill Care Community, with 2 positive cases, 1 staff member and 1 resident. The resident is individual, a male in his 80s. And we have some other negative results that have come back, 9 results on residents, 3 on staff, and we're awaiting other test results, and we'll be conducting more testing there as well. I'd also mentioned in my last report that we had 1 resident of a group home in Bradford, and I didn't provide the name of the group home because of the small number of individuals in these homes and the potential to identify the identity of people affected. Turning to my notes, I would say, therefore, we have a total of 259 confirmed cases to date. A total of 137 have recovered. 8 remained hospitalized. We've had 15 deaths in total. No change with regards to deaths since I last reported. So we've had a few issues come up, I would say, in the media. One is the topic of community gardens. So on Saturday, the province announced changes in its emergency measures to permit the use of allotments in community gardens. These are gardens set aside for people to grow their own fresh produce, their own food. And it was identified that this is part of the food system. And we need to support our food system and therefore allow for food production by this means. It also assists people in improving their access to healthy, nutritious, and affordable foods. And so the province is permitting this, and we are supportive of this. I am supportive of this. The province has indicated, though, that there will need to be guidance from the local medical officer of health as to how to do this safely. And so we're looking at that now with regards to developing our recommendations for these community gardens in order to maintain the physical distancing that's needed while people do this kind of work, produce food for themselves. So we'll be coming out with those recommendations shortly. We have new information, a new healthy living page under our COVID information website, and it provides more information, a lot of emphasis on healthy living. As I've said all along, these restrictions on our lives in response to COVID, although absolutely necessary to control this pandemic and to flatten the curve here and avoid overwhelming the local healthcare system, also are hard on us and hard on our health. And so there's a potential for people to be drinking more alcohol, for example. So we have information there about alcohol use and smoking and vaping, and therefore recommend that people have a look at that. Hopefully people will find that to be helpful. The Premier has given an update earlier this afternoon with regards to the planning ahead about how to de-escalate from these control measures, the physical distancing measures that the province has put in place and that we support in public health. Although, from my understanding, there wasn't a specific timeline, there were some broad criteria for how the province will be approaching its decision making as it goes. So they would be looking at consistent 2 to 4 week intervals of decreasing COVID cases as an important indicator to consider de-escalation. They'd be looking at the acute and critical care capacity in the healthcare system, including access to ventilators and personal protective equipment, wanting to be sure that the healthcare system would be ready if there was a resurge or another wave of COVID, that the system would be ready to handle that. So that would be important for them to consider when it comes to de-escalation. They'd be looking at how well we in public health are able to follow up on identified cases and our ability to follow up on 90% of cases within 1 day, and to be able to provide direction to cases for home isolation. And they'd be looking also at vulnerable groups, and I would imagine that would very much include our long-term care facilities and seniors, and looking at the testing findings and our ability to test in those populations and to quickly identify outbreaks in those populations in those settings. So those are the considerations that they're going to be looking at as they go forward in time. And I know that they're developing their thinking on this. Of course, it's a critically important task for them to be able to figure out just how we can safely de-escalate all these control measures as we truly get control of this present wave of the pandemic. So, the Premier's message overall is stay the course and maintain the protective measures, maintain your physical distancing, have patience as they work through this. I would suggest we need to acknowledge ourselves for having collectively flattened the curve. By no means are we actively on the downward slope yet. I'd say we're plateaued. We still are getting cases each day, but there are positive signs. So people need to stay the course to make sure that we don't lose control of those gains that we've made. Also, the Premier noted that people need to be mindful of the fact that the virus knows no travel bounds and it can travel with people. And I would echo what the Premier has said before and what local politicians have said about stay at your primary residence and don't go to your secondary residences in other communities. Don't go to your cottage because you can add to the burden of illness in those communities that may be less well equipped to be able to handle it and potentially infect people in those communities. So please stay at home in your home residence at this time. So we have another question that was brought up to us by the media earlier today, and it is, can the virus be spread by fecal and septage? So septage is actually the application of treated human sewage as a form of fertilizer. And so there are some residents in North Simcoe townships that are concerned about whether the septage being dumped near their dwellings is making the virus airborne. This is a good question. We do know from research that the virus is detectable in feces of individuals who've been infected. There has not, however, been evidence demonstrating that it's transmitted that way or that people have actually become infected because of that route of transmission. So in theory, it's possible. In practice, they haven't found it to date. And septage itself has, with that approach, there's been some measures taken to allow the sewage to have been reduced in its pathogen content over time. We do know that this virus on surfaces can last up to 72 hours, but not beyond that. So treating the sewage to allow it to be used for application should be a measure of comfort or reassurance. But I do think that's an important question, and actually I'm going to look into that further just to see if there's anything else in the research that would speak to that question. So at this point, I would be happy to take questions.
Okay, thank you, Dr. Gardner. Chris Simon, do you have a question for Dr. Gardner?
Yes, I do. I was going to ask you about the Ford Press Conference today. Based on what you know, Dr. Gardner, is there a timeline that you would think would be safe to begin to implement this three-phase reopening plan? So
I will have to have a look at the Premier's press conference, in that I've been tied up all day with my work. But my staff were kind enough to give me the notes that I have that speaks to the content of what he had to say. And I'm also actually involved at a provincial table that's looking at this kind of question, so I know it fairly well. I think that it would be impossible to give a specific timeline at this point. I think what we're trying to work out now is just an overall approach and the kind of criteria, the kind of measurements, epidemiological data that you would need to consider, or that the Chief Medical Officer of Health, Dr. David Williams, would need to consider as he advises the Premier about how to de-escalate. We do know that other countries are beginning to do this. We do know that Spain is beginning to do this with construction work, that Denmark has begun to do this with regards to return to school. It's always done in a very careful, stepwise fashion, not all at once, an incremental way, starting with what would appear to be safer means of or approaches to take us first steps, and continuing to monitor those indicators very closely as you do so over weeks, to be sure that you're not getting a sudden surge happening again in response to the individual steps that you take. So it is going to be prolonged, and I think it would be fair to say that it'd be premature to begin it now, because we still have a high degree of activity happening. We might have plateaued, but we're really not coming down. I think we'd have to come down quite a bit before we would start that process of taking a stepwise relaxation of the control measures, and with each step a very careful monitoring of the indicators of disease, and also indicators of the healthcare system being ready to manage any resurgence in disease.
Okay, and a follow-up question. I've asked you this before with regards to Sienna Senior Living, and at that point it was just the outbreaks at Spencer House, which has obviously now come online, and Bradford Valley. But now that we're seeing, again, a number of Sienna outbreaks, is there anything that this company should have been doing differently to prevent staff members from bringing the virus into the long-term care facilities?
So thank you for that question. We have not seen any specific indicators of a facility level lapse or an institutional or company level lapse that would explain a commonality between these locations.
Thank you.
You're welcome.
Okay, thank you, Chris. Erica Engel, do you have a question?
Hi, yes I do. Dr. Gardner, you talked about being on a provincial table addressing the question of how to relax or when to relax control measures. does that mean that you have a role when it comes to advising the government or the province's medical officer of health on how to proceed with this?
Thank you for the question. Not directly. I'm on a table with some of my other colleagues, some medical officers at health from across the province. It's already been noted in the media that Dr. David McEwen has been hired on to lead that table. He's a former medical officer of health of Toronto and has been an associate chief medical officer of health with the province before. And so we report to him on this. He has some ministry staff assisting him, looking at the research. He's used us as, I guess, as consultants to review some of the thinking that they're considering and the information that they're looking at and how we would interpret it locally, what our take would be on it. But at the end of the day, it will be really with our assistance, his product. He would give to the Chief Medical Officer of Health, Dr. David Williams, for his consideration as to how he would advise the Premier.
Okay, thank you.
So, then can you speak a little bit to, you talked about we would be relaxing, you would see us relaxing health control measures, but then you'd have to put them back in place should something happen. I wonder if you could explain what would, in your mind, trigger those control measures to be put back in place. Are you looking for increases in cases? Is it capacity?
Yeah, I think this really speaks to the fact that we're in this for the long haul with this virus, that we expect it to come and go in waves, and that it will persist until we get an effective vaccine, which could be another year and a half out or so from now. Therefore, we need these triggers for putting controls back in place. So we may find until the day that we get people well protected with vaccine, that it will come and go, that we need to monitor it coming and going as it declines, as a wave, that we can relax the controls. And the reason why we'd want to is for people's well-being and quality of life and for the economy and people to be able to make a living. So we'd want to be able to relax it when we can, knowing that we would probably encounter it returning at some point afterwards, weeks or months after, and would then need to be able to detect it and put in place in a graduated way, probably, control measures again in order to not allow it to get out of hand. Because we know from our modeling that if you just stopped all control measures, you'd end up with a big surge, that it would overwhelm the healthcare system, because despite this having been in circulation in our community and despite all the cases that we've detected, we fully anticipate that the great majority of people are still completely vulnerable to this virus, have no immunity to this virus, have never been infected.
Okay, thank you, Erica. Jessica Olin from Barrie Today, you have a question?
Yes, I was hoping to find out exactly how many recoveries have been reported at Bradford Valley, if any.
How about I look into that? Let me just have a look at my data and see if it's right available to me. I've mentioned that we've had 5 staff of the 10 staff recover.
Yeah.
I've mentioned that we've had 34 residents who've been cases, 7 of whom have died, one of whom's in hospital, doing well. But I do not have data right in front of me about how many of the residents have otherwise recovered. So I could inquire about that and see what I can get.
Okay, that would be great. And then my second question is, I just wanted to confirm that there are 5 long-term care homes in Simcoe County that have dealt with an outbreak of COVID. It's Owen Hill, Woods Park, IOOF, Bradford Valley, and Spencer House.
Yes.
And then there's the one group home that you didn't want to identify. I just wanted to confirm that those are the only long-term care homes so far that have confirmed cases.
That is correct.
Okay. Okay, great. Thank you.
You're welcome.
Thank you, Jessica. Dana Goldfinger from Global News. Do you have a question?
I do. Hi, Dr. Gardner.
Hello?
You said that a number of tests have come back with regards to the long-term care homes. Do you have a number in terms of the ones that we're still waiting on that haven't come back yet?
I'm afraid I don't have that. What I have is the figures that I gave about the numbers that were negative, but I don't have a complete listing of the total numbers that are outstanding.
Okay. Do you know if most of the results have come back, or if we're still waiting on?
So I know in the case of Bradford Valley, all of them have come back.
Okay.
Yeah, and for the others, no, not all of them have come back. Quite a few of them are still waiting. I know how many were collected and sent to date at IOOF. We had 120 on April 23rd and 120 on April 24th. I don't know how many more need to be drawn or how many have come back. And same with Woods Park. I had some figures about how many have come back negative, but I don't know how many are outstanding. And certainly that's the case with Owen Hill as well. I don't have data about how many are outstanding. We do want to do them all. The province has directed us to take tests on all residents and all staff when you have an outbreak at a long-term care facility. So certainly we're working to that goal.
Right. Okay. And then as well, I know it's plateaued in Simcoe and Muskoka. Are you able to give any indication to when you think the daily cases will start to go down in the region?
I'm hopeful it'll be soon. We do appear to be in a plateau. I'm glad that it's not going up. It's been generally under 10 per day for at least the past 2 weeks. We do know that we calculate what we call the doubling time, the number of days required, or the number of days in which there's, how long does it take? How many days does it take before we have a doubling of the number of cases? And we know in Simcoe Muskoka that that's been lengthening out, which is a very good thing. That's exactly what we want to see. And we also know that our doubling time is longer than it's been in the province. So I just pulled that up in front of me. The doubling time now in Simcoe Muskoka is 21.7 days. So it's taking almost 22 days to double the number of cases that we have. And that's up from a week ago when it was 14.9 days. So it's moving very much in the right direction. That's what you see when it's plateauing, slowing down. Obviously, when you start to get a decline in cases, then it's no longer doubling at all. It's rapidly declining, right? So Ontario is going up as well like that. It's behind us. Right now, their doubling time is 17.7 days, and it was 12.2 a week ago. So they're going in the right direction, and we're going in the right direction.
Great, thank you.
You're welcome.
Thank you, Dana. Doug Cross from the Muskoka region. Do you have a question?
Sure do. Dr. Gardner, I'm wondering if you're looking at the Saskatchewan plan at all, because unlike what Dr. Borden may have announced today, which was more, as he said, a map and not a calendar, Saskatchewan's got some hard dates. Is there anything that you might have seen there that made you tuck your breath in as a health officer and say, oh, I don't know if that would necessarily fit what we're doing here?
Thank you for that. They are, I would say, ahead of us on the downward slope. They leveled out earlier, and so they're now in a position where they can start looking at relaxing things. I think what I I've seen some information in the media about themselves and about Prince Edward Island as well. But I think I need to have a closer look at exactly what they're doing, because we want to be learning from the examples of other jurisdictions.
All right, that's all for me. Thank you.
Okay.
Thank you, Doug. Nathan Schubert from Moose FM. Do you have a question for Dr. Gardner?
Yes, I do. Good afternoon.
Good afternoon.
Dr. Gardner, I just wanted your personal opinion on this. What would be the most realistic conditions that we can meet to really implement Premier Ford's plan?
At this point, he has reflected some broad criteria for consideration as to when we would start to relax things. So, and what he reflected is very consistent with the kinds of discussions that we've had. So I certainly commend him on that. I think we have to continue our work of figuring this out in a very safe way and learning from others that are able to do it ahead of us because they're now in the downward slope ahead of us. I think he's rightfully spoken in very broad terms rather than getting too specific because we've yet to fully have figured out exactly what the approach will be.
So Premier Ford has been saying that his people have been saying that we're at the peak right now.
Mm-hmm.
Do you agree that this was a good time to release these plans, or should we have waited a little longer just to collect some more data as we slowly decline?
My understanding is, he was very cautious in what he released. My understanding also is that he's under a great deal of pressure to relax the control measures, and I can certainly understand, why he would be under that pressure. This has been painful experience for all of us and very hard on the economy and people's financial well-being, and so there's going to be a lot of counter pressure to relax those measures. So by communicating early what he can, perhaps he can help to address some of the pressure, some of those concerns. To me, I think it's a fair thing to communicate early what you can as a public official with this kind of situation.
Thank you.
You're welcome.
Thank you, Nathan. James Bowler from Cogeco. Do you have a question?
Yeah, thank you. My first question, Dr. Gardner, is just regarding the stipulations given by the government that we need to be reaching a 90% threshold to contact people who may have come into contact with COVID-19 patients. How close is our health unit to that threshold at this point?
So we are fortunate in that we're averaging perhaps 2 hours of being able to get a hold of people once we've got their laboratory test result. We've got a very good team. We've put together the great majority of our staff towards this. We've also had the good fortune of having a relatively low incidence of COVID-19 on a per capita basis compared with other areas of the province, and most notably Toronto. If you look at the daily epidemiology report on the Ministry of Health's website, it does include a map that compares health units by their population incidence, the number of cases per 100,000 population. And our incidence is about a third of Toronto's. So they have many, many more cases, plus it's a much bigger population overall. They have a massively greater number of cases to deal with. I think that health units like that would be a lot more challenged in being able to meet that threshold. But here in Simcoe, Muskoka, we've been able to meet it.
And my second question is in regards to this rollout of the economy. The third step is still stating that large gatherings will sort of be frowned upon or basically just not allowed. And I'm looking to Canada Day with Premier Ford noting that he wouldn't even be looking at sports or concert events until August. So I just wanted to hear from you, what is the likelihood here that we're going to just see all Canada Day events canceled?
I actually think that the likelihood is high. It's still well over a month away, but we've we're plateaued now. We're not rapidly coming down. the risks associated with large gatherings would be significant. You'd have to have this completely under control before you'd ever consider something like that, and chances are there will be until we've managed to vaccinate the entire population. There will be the need for restrictions on the size of crowds and some degree of physical distancing, because even with a relatively low circulation of the virus, the potential for it to start to infect larger numbers of people and ramp up would always be there. So I think we're going to have restrictions in our lives to some degree, to varying degrees as this waxes and wanes. But to some degree, you're going to see some restrictions until we can get a vaccine and bring this truly to an end.
Thank you.
You're welcome.
Thank you, James. Mandy Webster from Rogers, do you have a question?
Yeah, I have a few questions. Dr. Gardner, last week you said 800 tests was done at the two facilities in Barrie, IOOF and Woods Park. You said that it had been between staff and residents. So it sounds like we're still waiting for quite a few hundred to come back. Is that the case?
So thank you for the question, and I misspoke actually when we last when I was last meeting with yourselves. We intended, as it turned out, to take tests on over 800 individuals over a 3-day period. My understanding is that we'd actually achieved it. So I was wrong in that regard, and we did put out a notice right after the press conference indicating that. But my understanding is that we've achieved over 400 of those to date. It's not as quick as I would have thought, considering the goal of doing so in 3 days.
Perfect, thank you. Clearing that up. And does the Simcoe Health Unit track the number of retests? Like if we have to retest each resident?
I don't have a tracking tool for that. We, at this point, I think are challenged to test people once. The need to retest with an individual would be in an outbreak situation if they develop symptoms later. They're first found to be negative, and they're part of a facility that's an outbreak. We're monitoring and following up with that facility closely, and we find that an individual then develops symptoms, they would have to be retested. So certainly we know of the outcome of such testing. We know if the individual comes back positive or negative. But at my disposal right now, I don't actually have like a compilation of data about the numbers of people that have been retested.
Wonderful. And one more question. We had talked and asked you about some numbers of people who've gone through the testing facilities. Do you have those numbers handy just to give us some numbers from last week of who went through or how many went through test facilities? Yeah,
so I've got the data from our assessment centers. And so the data I have in front of me is from the weekend and from the week before. So not all of them are open on the weekends. The ones in Muskoka are not open on the weekends. And the numbers always go down on the weekends as opposed to during the week. So for Barrie, yesterday there were 36 people tested. The day before there were 37 versus on Friday there were 62. On Thursday there were 77. Alliston, I don't have data from the weekend.
Okay, I'm just really looking for Barrie.
For Barrie, okay.
And sorry, just a quick follow-up. Those test centers that you're referring to, those numbers, is that the Huronia Test Center as well as RVH, the little drive-through one that you can do?
So I don't have data from the drive-through at RVH. My understanding in inquiring about that is that that's a resource for RVH to have testing that would otherwise happen at their emergency department. So they redirect those in the emergency department. My understanding is they redirect those who've gone to the emergency department who need to be tested to that location, that way of handling it. And I don't have the data.
Okay.
I don't have the data from that.
Okay, so those numbers you gave me are strictly Huronia then?
They are.
Center there.
Yeah, from the Barrie CHC.
Wonderful.
You're welcome.
Okay, thank you, Mandy. Craig Momney, do you have a question for Dr. Gardner? Sorry, Craig from CTV, are you on mute? Okay, well, is there anybody else on the line that I may have missed?
Yep, Dawn from Huntsville Doppler.
Oh, sorry, Dawn, go ahead, please.
That's okay, Kathy. Thank you. Dr. Gardner, just going back to the assessment centers, could you also provide an update on the Muskoka centers, please?
Happy to. So they're not open on weekends. So the data I have is from before the weekend. So Huntsville, they on Friday had 7 that were tested, Thursday 9, Wednesday 8. Bracebridge on Friday they had 8 tested, Thursday 10, Wednesday 17.
Thank you. And further to your comment about the doubling time and the number of infections seeming to plateau, given that not everyone is being tested, do you have a sense of how much of that is just due to a lack of testing versus it actually decreasing?
So one of the indicators to help us deal with that is the percent positivity rate. And I'm trying to pull that up now, but that's the, if you look at the total, if you look at all of your tests and then you take the negatives versus all of the tests, what percentage are positive. And if that figure is going down, the percent of your tests that are negative are positive, I should say. The percent of your tests that are positive. If that figure is going down, that's a positive. That's a helpful indication. It means that the prevalence in the community is not going up. It's an indicator that you're plateauing or potentially coming down, and we are seeing that in our data. And so I think that would be also some reassurance for us that the plateauing that we're seeing is not due to missing more cases than we would have been before. It's not due to doing a poorer job of testing than we would have before. There's always the tip of the iceberg phenomenon that you have many more cases happening in the community than you know of from testing, because people don't necessarily go to get tested. They don't necessarily have symptoms and therefore don't get tested. So that's always part of the equation, always part of your consideration. So that's one of the reasons why we like to look at the percent positivity rate to help give us a sense as to whether or not the plateauing that we're seeing is real, or whether it might be due to us doing a poorer job in testing more recently than in the past.
Great, thank you.
You're welcome.
Okay, is there anyone else on the line that we may have missed? Okay.
Kathy, it's Erica from Collingwood today. Can I just get a clarification? Dr. Gardner, you mentioned, I believe the man's name was Dave McEwen, who has been hired to lead the table. Could you spell his name for me?
M-C-K-E McEwen. Let me just... I'm terrible at that. M-C-K-E-O-W-N.
Okay.
Yeah.
And is there a specific name for that table as well, or
The
that you're sitting on?
public health measures table.
Okay. And so you've been advising on how to lift those measures. Have you also been advising on what measures should be put in place as the cases climbed before?
Yes.
Okay.
Thank you.
You're welcome.
Okay, thank you very much, everyone. We hope to see you again on Wednesday. Bye-bye.
Bye-bye.
Thank you.
Thank you.